If you got a low sex drive, we are talking about how to fix it in this video, guys. I'm Dr. Jen. It is good to see you. Now, the first thing we have to focus on when it comes to low sex drive is the underlying cause, if there is one. Why? Because that's going to be likely the key to helping improve our libido. So let's talk about some common underlying causes of low sex drive. Number one, in no particular order, let's talk about medications. A lot of people don't think about medications when it comes to their sex drive, but medications can play a huge role with lowering our sex drive. Okay, you're probably wondering, okay, well, which meds can do this? Well, one class of medications that comes to my mind is antidepressants. Antidepressants can notoriously decrease sex drive for many people. I'm not telling you to stop your antidepressants, quite the contrary. What I'm saying is, if you think this might be you, please talk to your doctor, because oftentimes we can switch things around, make some changes, adjust doses, do different things to help with your sex drive. Other classes of medications that can lower your sex drive are sometimes blood pressure medications. Some blood pressure medications can contribute to erectile dysfunction. Some can lower sex drive in general. Again, don't stop your meds. Talk to your doctor, because often we can switch things around. Take a look. And then there are plenty of other medications that may impact your sex drive, okay? Huge. All right. Now, let's talk about hormonal shifts, all right? And sometimes we can absolutely do something about this. For men, low testosterone. Low testosterone for many men, a common symptom of that is decreased sex drive, low libido, decreased interest in sex. By the way, decreased testosterone, there's a lab test for that. We can do some blood work and check. We can also do further blood work to see potentially why you have low testosterone, which is always important. And if your doctor deems this is the right thing to do, we can replace your testosterone. There is testosterone replacement, okay? So hence, how to fix your low sex drive sometimes can be as simple, I say as simple as, but sometimes it is, as making sure your testosterone levels are normal, getting that fixed if your doctor feels that that is the right path. For women, let's talk about perimenopause, let's talk about menopause, let's talk about hormonal shifts, even outside of menopause and perimenopause. There are things we can do with that, okay? There's hormonal therapy. There are medications also that can help with hormonal shifts with women that may positively impact your sex drive, okay? So understand that hormones is a big one, and it's something that oftentimes can be fixed. All right, next thing, let's talk about our mood, our mental health. Depression and anxiety. Let me tell you something. A lot of my patients, when they're depressed or anxious, sex is not like the thing at the top of their mind, okay? That is a very common sort of side effect or symptom or sort of byproduct of being depressed or anxious. And by the way, don't beat yourself up if this is you, okay? Depression and anxiety, they are medical conditions just like any other that deserve treatment and acknowledgement, but just understand that a low sex drive can be a part of this. So in terms of fixing sex drive in this sort of sphere, often really focuses or needs to be focused on dealing with your mental health, making sure that you're in a good place, making sure that you feel good, you're getting the help you need, whether that's medications, therapy, both, and so much more, okay? And a similar one to that, by the way, I have like maybe 4-ish more. I didn't tell you how many I had, I'm sorry. It's like 7, 8-ish, but similar to that is stress, right? Stress, huge for decreased sex drive. When you are stressed, are you thinking about having sex? There probably are some people who are, but many of us are not, okay? Minimizing stress, okay? How do we minimize the stress just in general? Well, I have always said, if there are people or things or situations that stress you out that you do not have to be a part of, you better tell that situation to back it up, okay? I don't want to say cut things out of your life that don't work for you, but there is a part of me that actually does want to encourage you to only keep things that are good for you and positive for you within reason. And I know we can't always do that, okay? But I wanted to sort of give you that encouragement. I would also say making sure that you're getting enough sleep, that you're eating healthy, that you're exercising, that you're maintaining a healthy weight, that you're seeing your doctor, like all that kind of stuff is going to help with stress levels in general, okay? Let's now talk about underlying conditions. All right, so I remember, I'll never forget, I had a patient who came into me and she was really stressed out because she had really bad arthritis in her hips and in her knees. And one thing that was really tough was sexual activity with her husband, because from a positional standpoint, she really was unable to have sex due to the pain she was having due to her arthritis. And not only was the pain from her arthritis hard and painful and stressful and difficult, But it also then was negatively impacting her relationship with her husband from a sexual standpoint. And then that also was tough. And that ultimately affected her sex drive as well. And you see how all this stuff can be so layered, right? This video is really to encourage you to sort of think and to go beyond the layer. Like an onion, you peel away layers and you just keep looking and you keep looking. Remember that sometimes things are not as simple as they seem, but sometimes the solution may be a little bit more straightforward than we ever imagined. And so in the situation with this patient, one of the things we really needed to focus on was how do we sort of help her pain, help her underlying arthritic conditions and things like that. For her, it involved physical therapy, orthopedics, injections, and so many other things. But remember, low sex drive, we have to look sort of beyond what's right in front of us. And she and her husband were able to go on and have sort of a happy, healthy sex drive, okay? It is possible, y'all. See, I told y'all. All right. Let's also talk about the elephant or non-elephant in the room, which is substance use and abuse, okay? One thing I'll say about smoking is that cigarette smoking in particular, we know is a risk factor for like heart disease, vascular disease, so many other things. We know that vascular disease, as an example, can contribute to things like erectile dysfunction, cause erectile dysfunction, which obviously affects intimacy, right? And may also then affect libido as well. But what I will also say is that substance use in terms of drugs and alcohol can also negatively impact your sex drive, okay? If you feel that you have a low sex drive, you should think about your habits and the behaviors you're engaging in to try to understand if that may be playing a role. And obviously, we want you to be healthy. The next thing, and one of the last things I wanted to mention is I don't ever want you to forget your history, okay? A history of sexual trauma or a history of negative sexual experiences really is so important. And for many people who experience that, those situations and those experiences don't leave them. So I need you to think too about your sexual experiences, your libido, and how you're feeling, and think, sorry, hair going crazy. I want you to think if there's any experiences that you've ever had or other that may be impacting your libido. In which case, we are talking about in this video how to increase our libido. One of the ways to approach this would be to get help, to talk to a therapist, to talk to your doctor, etc. So you see the kind of theme here. We're talking about working to fix our libido by trying to think about what may impact it. I don't want to imply that every one of you out here who's watching this video is going to have something that we can literally fix like that and thus fix your libido. But I would argue that there's many folks out there where this might be the case. So do some thinking, do some digging, talk with your doctor. Also, let me know if this video is helpful. Share this video with your partner, with other people who it may help, okay? Let me know your experiences because what you share often helps other people. Guys, I'm Dr. Jen. Please subscribe to my channel. Please follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, you name it, all the stuff. Also, go to my website, drjencaudle.com to sign up for my free health newsletter. Guys, I'm Dr. Jen. Hope this is helpful.